Hi, welcome to my YouTube channel. My name is Kongari, and in today's topic I'm going to discuss about types of anesthesia. Welcome to my YouTube channel. If you have not subscribed to this YouTube channel, kindly do so. Remember to hit that like and notification bell. For any time we upload a new video, you'll be among the first person to be notified. Now, let us jump right into today's topic. Types of anesthesia. First, we have something we call general anesthesia. This is whereby you are given an anesthetic drug which will knock out your whole body will be under anesthesia. You'll not be cannot even control breathing, cannot control anything. Now you will breathe even when it comes to breathing. They will use tubes. We call them ETT tubes. You have the LMA. You have different types of tubes that they are being inserted into your system, then connected into a ventilator, and they will assist you with breathing. That is what we call general anesthesia. Your whole body is anesthetized. Now we have something called regional anesthesia, and this is whereby you want to anesthetize or you want to freeze maybe a large part of your body. For example, if your surgeon wants to operate on your hand or on your leg, they will come, on this hand, your anesthetist, anesthetist is the doctor who is responsible for you sleeping, reversible sleeping, pain-free procedure. That is who we call the anesthetist. The anesthetist will come identify. In this case, I'm dealing with the hand. Yeah, they will identify a nerve fiber around this hand. Then near that nerve fiber, he will deposit those freezing medication or in this case, let me call them the freezing medication for a person who doesn't understand what anesthetic drugs are. Yeah, they come deposit near that nerve fiber the anesthetic drugs or the freezing drugs. Then your whole hand will freeze. You won't feel any pain during that procedure. That is what we call regional anesthesia. Then we have something we call local anesthesia. This is whereby you operate on a small area like on a hand, yeah? Maybe removal of a lipoma or removal of an ingrowing toenail, yeah? The anesthetist will come with the drugs, then he or she will deposit near that around that area that they want to operate. That finger, that maybe in the case maybe it's a finger, yeah, it will freeze. Maybe, okay, in layman terms, when you want to operate on a small area or on a small surface, that is where we use local anesthesia, yeah. That and that is why I was giving you an example, like when you want to operate on a finger, you will freeze this finger using those anesthetic drugs, then you operate on it. We have another option which we call spinal and epidural. This is majorly during cesarean section, or maybe you want to operate procedures from the belly downward. That is where we use spinal and epidural. We have the difference between these two. During spinal, you will inject here near the back at the spinal column. We inject there. There is usually a place where the anesthetist locate. Then they will be injected with the anesthetic drug, and in spinal, you're being injected your drugs once and operation goes on. But when we talk about epidural, your anesthetist will inject you, then they will leave that catheter there in situ, and you will be given continuous delivery of medication. I hope you understand, yeah. Spinal is just one shot, but epidural, it's a continuous process. Thank you. Remember that good health is your responsibility. Adios.